Hi, everyone, and welcome to our health talk. My name is Alina, and my pronouns are she, her, and hers. On behalf of the Patient Education and Engagement Program here at the University Health Network, thank you for watching this session on stroke, sharing risk factors and strategies for prevention. At UHN, we strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of this land and for thousands of years have cared for this land. Although we are presenting this health talk in the digital world today, we want to acknowledge and remind ourselves and encourage you too to do the same wherever you are currently located, that we are still on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon Wampum Belt Treaty, an agreement to share for and protect the resources around the Great Lakes in peace and respect. Today, this territory is still the home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work, learn, and play on this territory. June is Indigenous Heritage Month, which celebrates an opportunity to learn more about Indigenous culture, heritage, and experiences. We encourage those watching to watch a previous health talk with UHN's Indigenous Health Program to learn more about healthcare services that are available to Indigenous patients and families. Tailoring healthcare services that incorporate Indigenous cultures and traditions is important and necessary to ensure good and safe health for Indigenous peoples. And thank you for joining us in acknowledging this land. June is also Stroke Awareness Month. We really recommend you to check out a previous health talk to learn more about what a stroke is, the different types of stroke, signs someone is having a stroke, and different treatments or risk factors. We encourage you to view the first health talk before watching this one to get a good sense of the basics of a stroke, and we'll have that linked below. I would now like to introduce the speakers for this session. Catherine had a stroke on October 31st, 2015, and since then has been a member of the Patient Partner program at UHN over the past 7 years and a member of the Toronto Stroke Network Patient and Family Advisory Committee. She also has been a caregiver to her partner over the past 10 years. Dr. Alexandra Picalou is a vascular neurology and lifestyle medicine specialist, a JF Sunshine Chair in Stroke Prevention and Cerebrovascular Brain Health, and a director of Stroke Neurology Research Program at UHN and Krembil Brain Institute. She's an associate professor of medicine at University of Toronto with academic interest in stroke prevention and stroke outcomes, with a specific focus on young adult populations and women's brain health during midlife. Molly Furt is a registered dietitian who graduated with a Master's of Applied Nutrition from the University of Guelph. She works at the Toronto Western Hospital Neurovascular Unit and Stroke Prevention Clinic and is passionate about supporting her patients in their individual health journeys. Rachel Wong is a physiotherapist who graduated with a Master's of Science in Physical Therapy from the University of Toronto. Throughout her career, she has worked with patients with a stroke and other neurological conditions in various settings, including inpatient rehab at Toronto Rehab, as well as in acute care. Rachel is currently working at Toronto Western Hospital's Neurovascular Unit, Stroke Prevention Clinic, and Stroke Outreach Program. She's also an adjunct lecturer in the Department of Physical Therapy, Faculty of Medicine at the University of Toronto. And Lindsay D'Souza is an occupational therapist who works at the Toronto Western Hospital on their Neurovascular Unit, Stroke Prevention Clinic, and Stroke Outreach. Lindsay is passionate about stroke care and striving towards best practice within occupational therapy practice, as well as empowering persons living with stroke and their caregivers with knowledge and resources. So we have a wonderful group of speakers today, and they will be talking about lifestyle modifications to help you reduce a risk of a stroke, the importance of healthy eating and physical activity, setting goals for your recovery process, and better stroke prevention. So with that, I'd now like to pass it over to Catherine, who will share her story.
Hello, I'm Catherine. I'm very happy to share my story with the UHN teams. I had a stroke in October 2015. I was in a sushi restaurant with my sister and niece. Luckily for me, the restaurant was blocks away from Toronto Western Hospital within the UHN network. I was a patient at Toronto Western for 12 days. In early December, I began as an outpatient at Toronto Rehab. I also have experience at Princess Margaret and Toronto General Hospitals. My partner is a cancer outpatient. We are very thankful to have UHN on our health issues. My experience at UHN after my stroke was really good. The UH teams are welcoming, kind, and most importantly, they are professional on their respective specialties. I had the benefit to work with doctors, physiotherapist, occupational therapist, speech therapist, and dietitian. I was invited to participate with a group of brain injury patients who met for 8 weeks. I was also invited to join a cardiac exercise program at Rumsey Center. The most important point of having worked with these UHN teams, I felt I was part of a community. I never felt alone on this journey to take me back to my own self. For example, when I planned to travel to Rumsey Center by public transit, I felt worried about taking the subway and finding my way to the bus transfer. My occupational therapist went with me to Rumsey as a trial trip. She showed me where to get assistance if needed and the bus transfers. She absolutely reduced my fear. I suffer from aphasia, and my communication skills were a challenge. The UHN team never made me feel embarrassed. They knew what I needed and made my journey easier on my path. And best of all, they felt like family. When our paths have crossed since that time, it feels like meeting with an old friend. My suggestions for stroke survivors are, firstly, always join in everything that is offered. I was very depressed and I wanted to stay home and stay in bed. In early days, I made a pact with myself that I would get dressed and get out every day. I never missed a clinic session or in an organized group. Secondly, participate in the groups that you join in. Share. If you have a problem or questions, let someone in the UH team and fellow patients know. Don't keep your problems to yourself. I made good friends through my stroke and UHN. UHN is always supportive. Finally, step outside if you need a fresh breath of air. Often I would put on my coat and step outside and take a big breath of air. If I could, I would walk around the block. I always felt better. It was like the wind blew my depression away. A great resource is the Toronto Stroke Network Guide. It is well organized and well written. It covers many topics that a stroke survivor needs in living their lives. I didn't understand that depression is part of the stroke injury. I felt ashamed that I was depressed. I didn't tell anyone about that. When my doctor asked, I would deny it. It was only after I admitted to my depression, I had help. That was my best decision. After I got on track with the correct drugs, I felt much better. Thank you for inviting me today. Hello to my old UHN team.
Thank you, Catherine. We really appreciate you sharing your story and tips you've learned throughout your recovery. It's sure to help a lot of people. I would now like to pass it over to Dr. Alexandra Picolou, who will take us through the presentation. Over to you.
So thank you, Alina. It's really my pleasure to be here with everyone and talk about stroke prevention, because that's the way to go if we want to talk about brain health. However, I want to also reflect on some important educational points that come from initial health talk on stroke. It's really to remind us what is a stroke or what we call brain attack? A stroke is a sudden loss of brain function, and it can represent as a speech, gait, power in the upper or lower limbs, or perhaps swallowing deficits that is caused by a sudden brain blood vessel blockage, and we call it ischemic stroke if that happens, or perhaps if it ruptures the vessel, can cause bleeding and cause what we call hemorrhagic stroke. A TIA, or transient ischemic attack, on the other hand, it's called a minor stroke. And even it's a minor stroke, and it can happen again when the blood supply to the brain stops only for a short period of time, from 1 minute to a couple of minutes to 1 hour, up to 24 hours. The TIA is really a high risk for subsequent stroke, and the person should be assessed immediately. And that's essentially opportunity for prevention. Who can have a stroke and how frequent it is? First of all, stroke frequency is on the rise all over the world and in Canada as well. Stroke can happen at any age, and it's not only an elderly disease. So about 40% of strokes is seen in people that are less than 65 years of age. So something really important to remember. About 55,000 more women than men have a stroke each year. And in Canada, even as we talk now, every 5 minutes somebody has a stroke. But what are the signs of stroke? And it's something that everyone should have understanding of and knowledge. And we developed the acronym, which stands for several important points that I would like you to remember. Fast warning signs mean F for face. If you see or you've experienced perhaps facial droop or numbness in one side of the face, or a person is unable to smile, that's the sign of stroke. A for arms. If one arm is weak or perhaps numb, or if you ask a person to raise both arms and one is dropping, that's the sign of stroke. S stands for speech. If you ask the person to repeat a simple phrase or is unable to talk, or you are perhaps not able to talk, that means you might be having a stroke. T stands for time, and if you observe any of these symptoms or perhaps experience any of these symptoms, please call 911 immediately. In addition to fast signs, there are other less common signs, but important to know. First one is sudden onset of balance or dizziness that you experience that you never had before, and it feels like you're drunk. Or perhaps loss of vision, which is an eye symptom. So we always say, be fast, call 911, because we can do a lot in acute care and perhaps reverse some of these symptoms if you come on time. However, it's really important to know what puts you at a risk for a stroke. There are some risk factors that are called stroke risks that you cannot control. The older you get, the higher the risk. Sex, as it stands, mostly for men, is associated with stroke. However, in midlife, women tend to have higher risk than men during the aging process for stroke. Race, family history, genetic risks, and prior strokes are also risks that you cannot control. However, some medical risks such as high blood pressure, high cholesterol, prediabetes, diabetes, heart disease, specifically atrial fibrillation, which is irregular heartbeat, and cancers are medical risks that you can control with medications and through a close follow-up with your doctor. Lifestyle risks are numerous, and there are a couple of listed here that can be changed and you can control them. Really, this is the major opportunity for everyone when we think about stroke prevention. There are some sex-specific risks, such as risks for women during the childbearing age, during pregnancy, postpartum, menopause, as well as during elderly age when women have more atrial fibrillation than men. So while we cannot control all the risks factors, it's important that we focus on those that we can control or perhaps change. So let's talk about medical risks that you can control. One that is most important, probably the most contributing and the strongest risk factor for any type of stroke, hemorrhagic or perhaps ischemic, it's high blood pressure. So about 50 to 60% of all strokes are due to elevated blood pressure. It's a silent killer, as they call it. So usually doesn't come with symptoms, but it can cause stroke if you have it for a prolonged time. High cholesterol, or as we call it, hyperlipidemia or dyslipidemia, can cause buildup in the vessels, so obstruction of the flow to the brain, as well as it can actually build up the plaques that can chop off and travel to the brain vessels and cause the stroke. High blood glucose, if it happens for a prolonged time, can cause diabetes mellitus, and diabetes by itself can double your risk of stroke, and it can even triple your risk of stroke after age of 50. Heart disease, specifically atrial fibrillation, increases stroke risk by 5 times. So it's really important to closely follow up with your family physician, doctor, that can screen you for those risks. When we talk about lifestyle risks you can change, well, first of all is physical activity. About 35% of all strokes are contributed to physical inactivity, and it's something that we certainly can take care of. Dietary habits such as food choices, 25% of all strokes are contributed to unhealthy food choices. Smoking and vaping of any kind doubles your risk of stroke. Alcohol doubles your risk of stroke if used in excess, especially for bleeding strokes. And stress, which is a silent risk of many conditions, including strokes, when prolonged and when over time, can lead to unhealthy behaviors because people tend to eat or make poor dietary choices, they don't sleep, and they tend to use different substances to ameliorate the stress. So sleep, such as poor sleep habits, can lead to substance use, more time to eat, poor food and activity choices, but there are certain sleep conditions that can also lead to increased risk of stroke, such as prolonged sleep apnea as well as insomnia. So how can we prevent stroke? First of all, it's a good news that 80 to 90% of all strokes can be prevented by healthy lifestyle choices or by knowing your numbers. There is a primary stroke prevention that you need to know about because that's the way to start. It's essentially a way of preventing the first ever stroke. The focus is on your lifestyle factors to prevent or treat medical risks for stroke. Hence, this way you can prevent a stroke as well. So the goals are to change your habits, and perhaps you might end up having some prescribed medications. And this is the way to essentially approach your family physicians when you can do the most. However, if someone has a stroke, the secondary stroke prevention, it's a new opportunity. It aims to limit the risk of stroke after you already had a stroke. And while it's focused mostly on your medical risks that led to first stroke, the lifestyle modifications are critical moving forward. So the goal is to make sure you're on appropriate medications, but also to help you change your habits for long life and better brain health even after stroke. So what do you need to talk to your doctor at every visit? Start with 3 most important risks. Understand your numbers and understand your current recommendations. As we mentioned, blood pressure is really the critical risk factor for stroke. Start checking your blood pressure as early as in your 40s, or even earlier if you have family history of heart disease or perhaps stroke. Normal blood pressure, for everyone to know, is less or equal to 120/80. And that's an optimal blood pressure. Anything above that needs to be checked with your doctor. Physical activity habits is ask your doctor, how often do you move and what's appropriate for you? Because that may depend on your medical condition, but more active you are, the better stroke prevention it is. Current recommendation is that everyone does at least 150 minutes of moderate physical activity such as brisk walking or perhaps gardening, or 75 minutes of vigorous activities such as biking uphill or perhaps swimming laps. And this is done per week. Anything that is affecting your perhaps joints or perhaps you have heart disease needs to be modified, but you still need to be active. Dietary habits. It's important to know what's on your plate. Choosing better food, it's really important, and you can do it through the small steps, and you'll hear later on, how that's done. But healthy eating pattern is really a whole, predominantly plant-based fresh food, full of veggies and fruits, with some lean meat or fish, nuts, seeds, and olive oil. What else do you need to ask your doctor? Well, you can add 3 more. Cholesterol level, it's really important. Understand what means high level of bad cholesterol or perhaps low level of good cholesterol. Because if you're exposed to high levels of bad cholesterol and for a long time you don't have the protective cholesterol in your blood, that can put you at risk for stroke. And cholesterol is something that we can modify by diet, physical activity, and even normal blood pressure can modify the cholesterol level. But you may end up needing some medications as well. Sugar level, how much is too much? Blood test for diabetes needs to be done on every visit every year. Sugar level can be also controlled by diet, physical activity, and optimal weight, but again, there are medications that you might be prescribed. Make sure you know your weight and what means overweight in your case. Losing as little as 5 to 10 pounds can make a significant difference on your stroke risk by controlling blood pressure, blood sugar, and blood cholesterol levels. There are a few more questions that you might ask your doctor. How many hours you need to sleep? What's the quality of your sleep? Do you need sleep study? Perhaps if you have snoring, and because that can put you at risk. And in fact, sleep apnea is one of the signs that the person might have high blood pressure. Sleeping 7 to 8 hours is optimal. Sleep improves brain function and reduces the risk for chronic diseases and your medical risks for stroke. Smoking habits, use of inhaled nicotine in the form of traditional cigarettes, e-cigarettes, vaping is the major stroke risk. Quit smoking of any type. And then we come to alcohol use habits. How much is too much? Ideally, do not drink, but if you drink, 1 to 2 drinks a day for a man and 0 to 1 drinks a day for a woman is current recommendation. So really take control over your health. Talk to your physician. Make sure you know all the answers. You understand why you're taking your medication as directed. But always remember that 80 to 90% of all strokes can be prevented by what you do on a daily basis. Reduce stress, which may contribute to, as we mentioned, behaviors such as overeating, lack of physical activity, unhealthy diet, and smoking. Have regular medical checkups, including assessment of your risk for stroke, and always come ready with the questions. So I hope you learned something new, and I'll pass it on to Alina. Thank you.
Thank you, Dr. Piccolo. I will now pass it over to Molly, who will talk about healthy eating. Over to you.
Great. Thank you so much for having me. And thank you to Dr. Petula for that great information. What we're going to spend the next few minutes on is talking about how we can eat healthy to reduce our risk of stroke and what that might look like on a day-to-day basis. Eating healthy can help you to improve your blood cholesterol levels, help you to control your blood pressure, and also to help you reach and maintain a healthy weight, which looks a little bit different for everybody. Next slide. The Canadian Stroke Best Practices suggest a Mediterranean or DASH eating pattern. Today, we're going to focus on the Mediterranean eating pattern. So you can see here, there is a big focus on plant foods like fruits, vegetables, whole grains, and protein from plant sources like beans and legumes. There's a highlight on heart and brain healthy fats like olive oil, nuts, and seeds, an emphasis on fish as well as seafood. Low-fat dairy, poultry, and eggs can be included in moderation, which generally looks like daily to weekly. And then our smallest section, red meat and sweets, can be included less often, more like weekly to monthly. We're going to talk a little bit more in depth about each of these components shortly. And I also wanted to highlight that a big part of the Mediterranean diet is focusing on eating with others, if that's something that's accessible to you, and cooking at home more often. Thank you. This is Canada's Food Guide. You can access it on the website that's listed on the slide here. As you can see, it emulates a lot of the principles of the Mediterranean diet. You can see there's lots of colorful fruits and vegetables on the plate, whole grains, and a variety of different protein foods. So let's look at what this might look like day to day. We're going to zoom into some of the key foundations of the Mediterranean diet, and the first would be our fruits and vegetables, which are to be included daily. Next slide. Starting with the color on your plate, fruits and vegetables are a cornerstone of the Mediterranean eating pattern. For vegetables, aim to have 2 handfuls or half your plate at lunch and dinner. They can be frozen, canned, or fresh, whatever is accessible to you. Be sure to look for no added salt or low sodium on your canned and frozen vegetable products. For fruit, aim to have 1 serving at breakfast, snacks, or meals, whenever works best for you. 1 serving is about 1/2 to 1 whole fist size, and fruit can be frozen, fresh, or canned in water. Next slide. So let's talk more about the next section of the eating pattern, which focuses on whole grain foods and plant proteins like beans and legumes. We're going to talk a little bit more about healthy fats a bit later. Whole grain foods are high in fiber and low in saturated fat. Try to include whole grains in your diet daily. Whole grain foods include things like oats, whole wheat products like whole wheat pasta or whole wheat bread, brown or wild rice, corn, bulgur, quinoa, and many more. Next slide, please. Include more plant-based proteins in your diet. These are things like beans, peas, lentil, and soy protein like tofu, tempeh, and edamame. If this is something that's newer to you, try to aim for 1 vegetarian meal per week to get you started. Some of my favorite plant-based proteins include mixed bean salad, tofu stir fry or tofu curry, bean chili, or falafel. There's lots of great recipes on the internet, or if you browse your local library for plant-based cookbooks, there's lots of good recipes out there. Many clients ask me about imitation meat products such as veggie sausages or veggie burgers. These products are typically high in saturated fat and sodium, so I usually recommend prioritizing whole foods like these listed here on the slide over the imitation meat products. Let's switch gears and talk a little bit more about healthy fats. The type of fat to eat less of includes saturated fats and trans fats. Eating too much of these fats can negatively impact your blood cholesterol levels. Saturated fats include high-fat dairy products like butter or ice cream, animal fats like the fatty cap of a steak or the skin on poultry, and plant oils such as palm or coconut oils that are solid at room temperature. To reduce your saturated fat intake, try to remove any visible fat or skin from meat or poultry before you cook it. Choose low-fat dairy products when possible, and choose to cook with healthy oils like olive or canola oils. I also recommend choosing a nut butter without added palm oil, the kind that you have to stir before using, as this will be lower in saturated fat. However, not all fats are bad. Unsaturated fats like nuts, seeds, and olive oil and avocado are great to include in your diet. One type of unsaturated fat is called omega-3 fats, and having enough omega-3 fats in your diet is linked to a healthy heart and brain. Sources of omega-3 fat include salmon, mackerel, and trout, and sardines. If you are a fish eater, try to include fish 3 times per week. If you are not a fish eater, try to include some plant sources like walnuts, chia seeds, flax seeds, or hemp hearts. The last pillar of eating well for stroke prevention that we're going to talk about today is eating less salt, or sodium, which is the chemical name for salt. Eating less salt can help to control your blood pressure, which many people in Canada eat too much salt and they don't even realize it. Reducing your salt intake doesn't just mean putting away the salt shaker from your table, although that is a really good place to start. Salt is often added to a variety of foods during their production. So by the time that we even bring something home from the grocery store, it doesn't even matter if we're not adding it during cooking. Sometimes we can have a high salt diet. Some of the biggest sources of salt in the diet here in Canada are processed foods like cured meats, deli meats, pickles, crackers, chips, pretzels, and any sort of food made outside the home, such as from a restaurant, from takeout, or from the hot counter at the grocery store. Next slide. When grocery shopping, try to choose fresh, unprocessed foods more often and look for no added salt or low sodium packaged products. There will be a kind of a flag on the front of the pack. Flavor your foods without salt. Use aromatics like onion, garlic, lemongrass, ginger, herbs, and spices, or try making your own spice blends at home. You can also use some no added salt seasoning blends from the grocery store if you're interested. You can even add tartness to your meals by using citrus like lemon or lime or some vinegar. And with that, I'll pass it over to Rachel, who will speak about another key lifestyle factor in stroke prevention, which is exercise.
Hi, everyone. I'm Rachel. Thank you, Molly, for that great presentation. I will be focusing on physical activity for this next portion of the presentation. So here on this slide, you can see a list of risk factors for stroke. And many of these may look familiar to you. Not to be alarmed, because these are known as modifiable risk factors, meaning they can be changed. Being physically active through regular aerobic exercise can combat these risk factors, which in turn will help reduce the risk of stroke. So what is aerobic exercise? You may hear this being referred to as endurance training or cardiovascular exercise. This type of activity is performed for a longer period of time rather than short bursts of activity. And this in turn will help increase your heart rate, your blood circulation, and your breathing rate for a sustained period of time. And aerobic activity is usually performed at a moderate intensity level in order for this to be beneficial. So this means that it's above the difficulty level of normal daily activities so that it's therapeutic. But at the same time, it's not too high of a level that the exercise can't be carried out for a longer period of time. So some examples of aerobic exercise may include walking or jogging, swimming, dancing. It can include the use of equipment like treadmills, bikes, steppers, ellipticals. In my experience in working with clients in different areas of the healthcare system, aerobic exercise can often be adapted to cater to any individual's level of abilities, such as by adjusting the difficulty level or the use of adaptive equipment like a stationary bike. Okay, so now we're going to move on to how you can plan an exercise program for yourself. And we're going to go over the FIT principle, which goes over different components of an exercise program. And each of these are key to creating a successful program. The FIT principle stands for frequency, which means how often should I be exercising, intensity, so how hard or how much effort should I be exerting during my exercise, time, so how much or for how long should I be exercising, and type, so what kind of exercises should I be doing. So here on this slide is a summary of the Heart and Stroke Foundation's recommendations. For frequency, which is the first portion of the FIT principle, the recommended goal is exercising at least 3 days per week. So depending on your fitness level, you may or may not be able to do this right now, but if you can't, don't feel discouraged. You can gradually work towards these goals. For the second portion of the FIT principle, we have intensity. And as mentioned earlier, we are aiming for a moderate level of intensity for aerobic activity in order to be therapeutic. It's important to be monitoring your intensity to make sure you're challenging yourself enough so that the body is benefiting from the activity, but also to make sure you're not overly exerting yourself. So one simple way you can measure the difficulty level is called the talk test, which means you should be able to carry on a conversation comfortably during the activity. So for instance, if you're really panting and really having a hard time getting words out while jogging, you're probably working too hard and want to slow down the pace. Alternatively, if you're able to comfortably sing, say, for instance, an opera, you might want to increase your speed to increase the challenge. From my experience as a physiotherapist, I always want to make an important note that exercise programs need to cater to the individual. What might be a moderate intensity level to an Olympic athlete will not be the same for someone who's usually quite sedentary. So I always recommend my patients listen to their own bodies and to know, how much effort they really are exerting. Moving on to the first T then in the FIT principle, time, the goal is to be accumulating a total of at least 150 minutes of moderate activity each week. Again, this is the goal for the future, so this doesn't have to be today or tomorrow. It's okay to start with multiple 10-minute sessions if you have a lower endurance, and then over time, progress up to longer sessions. And lastly, for what types of activity, it's important to choose a variety of exercises you enjoy. This will help you stick to your exercise program. If you don't like it, you're not likely to stick to it and won't do it. So we've been talking about aerobic activity so far, but as you begin to feel more comfortable with your routine of physical activity, it will be important to create a more comprehensive exercise program by including in different types of activities, like those that target strengthening or balance or flexibility. And here are some extra considerations when doing physical activity. So firstly, you may want to consult your healthcare provider, like your family doctor, about what parameters you may need to work under during exercise, in terms of, for instance, your heart rate or a safe range for your blood pressure. It's important to know what thresholds you should be working under when you're doing activity. You can also use fitness trackers or devices to assist with monitoring your progress. So these might include your phone app, pedometer, GPS trackers, or a lot of people now are using Fitbit, those types of technologies. Or alternatively, rather than using technology, you can simply use pen and paper and track it down, like write it down on a table. And you can see an example of this on this slide here in the image. Include a 5 to 10 warm-up period and a cool down period before and after your exercise session to help your body adjust. And you can consider indoor activities if needed based on the weather. And lastly, you can also use adaptive equipment if needed. So for example, if there are balance impairments, you can always modify using different types of equipment to help you. I've worked in a wide range of settings with patients with a wide range of abilities. And so I've seen how you really can adapt activities to cater to everyone's individual abilities and tolerance levels to ensure safer participation. Thank you. And now I'm going to pass the time over to Lindsay.
Okay, hi everyone. Thank you, Rachel, for your very insightful talk. And I'm going to take this a little step further. Given all the information that you have just received, you might be wondering, I want to make some changes, but where do I start? So in this next section, we are going to talk in detail about how to set some goals. So goals could be short-term or long-term. Some examples of short-term might be that they could range from weeks to months. They might also be small steps to reach an overarching goal. Goals that are long-term might range from a year to multiple years, and they are made up of multiple short-term goals. Goals should be set using a SMART format. What does SMART mean? So the S refers to specific. So think about, what do you want to do? The M refers to measurable. So this might refer to, how will you know when you have reached it? A is achievable. So think about, is it in your power to accomplish it? R is realistic. So think about, can you actually or realistically achieve it? And T refers to time frame. So when do you want to accomplish it? So let's talk about some examples. So for example, it could be, I want to make a healthy dinner for me and my family 2 days a week by next month. Or another goal could be, I will do a 15-minute yoga video on YouTube 3 times a week, 3 months from now. So in this example slide, we're going to talk about that a little bit further. We're going to put together the long-term goals, the short-term goals, and break it down for you a little bit more. So as a long-term goal, it could be that I will walk a loop of High Park in 1 hour by the end of 3 months. So this is a big goal. So in order to achieve this goal, you may wish to set some short-term goals to help you achieve this long-term goal. So some short-term goals could be, I will ask my friend to join me and choose days to practice by the end of the week. It could also be that I will walk for 30 minutes on Mondays and Thursdays by the end of week 3. I will walk for 45 minutes on Mondays and Thursdays by the end of week 6. So essentially with these short-term goals, these are all setting time frames. So by the end of that time frame, you can reevaluate your goal and then reset some new short-term goals to help you work towards your long-term goal. Next slide. So some more tips for goal setting can include considering if you are ready, because your buy-in is probably the most important thing with sticking to your goals. It's also important to make sure that your goals are meaningful. Make sure it's important to you, that you feel motivated to work towards it, that it's something that you actually want to work towards. Involving others is also a great strategy. Set goals with your friends, family members with similar interests, and also share your progress. Also, you can review your progress and adjust as needed. So some of you may wish to track your progress, and that way you can see your successes. So some tools that you might find useful are listed on the screen here. So maybe using a calendar to write out your short-term goals. So for example, in the previous example, we talked about the days maybe you might be walking to work towards that bigger goal of walking a full loop of High Park. So maybe on those, using the calendar to track your short-term goals could be helpful. There are also a number of apps that are available that you can use. Maybe even journaling. You might find it helpful to journal how are you working towards your goals, how you're feeling, and maybe even your own personal motivation and buy-in towards working towards these goals. So now I will pass it back to Alina, who's going to talk further about more resources.
Great, thank you. I wanted to take a moment on behalf of the Patient Education and Engagement team here at UHN to thank all of our speakers, Catherine, Dr. Pigaloo, Molly, Rachel, and Lindsay, for speaking at this talk today, sharing your expert knowledge and your experiences. Here are some resources to look to for some more information, such as the Heart and Stroke Foundation, the Toronto Stroke Network, which Catherine mentioned, Smokers Helpline, and March of Dimes, which supports people living with a disability. You can also find a list of these websites linked in the description box below. And you're always welcome to contact the Patient and Family Learning Centers at UHN. They offer reliable and up-to-date health information to patients, families, healthcare providers, and members of the public. All of their services are free and available in multiple languages. You can always call, email, or visit their centers Monday to Friday between 9 a.m. and 4 p.m. Your feedback is also important to us, so please go to the link on your screen and complete the survey. This link is also available in the description box below, and your feedback will help us to create more content that you are most interested in. And you can also subscribe to our online patient e-newsletter to get up-to-date information about events and new resources at UHN. You can fill out a form to subscribe and the link on your screen, or we'll have the link available in the description box below.